Another day, another rise in the number of people struck down by measles.
As of today, in Auckland, we have had 804 confirmed cases of measles. That's an increase of 26 from the number on Saturday. And so that's increasing at a constant rate of around 18 to 19 a day, which we've been seeing for the last couple of weeks.
Auckland Regional Medical Officer of Health Dr William Ranger today stressing the urgent need for anyone not yet immunised to get their jab immediately.
Measles is a preventable disease. It is preventable by vaccination. Vaccination is safe.
Among those being told to get immunised are students at more than 20 Auckland colleges who were at a St Peter's ball on Saturday night, which was attended by a student from another school who may have measles. St Peter's College Principal James Bentley asked parents to keep their sons at home during the contagious period from the 9th to the 16th of September if they have not been vaccinated. But Dr Ranger says they do not yet have a laboratory confirmation that the student who attended the ball had measles, and he's not requesting unvaccinated students stay home.
It's a suspected case. It hasn't been confirmed as yet. We would get the blood test result back. I think the schools have been proactive in terms of giving their families a heads up, and that's possibly been misinterpreted.
There have been more than 50 schools with confirmed cases in the Auckland region this year. But despite the highly contagious nature of the illness, Dr Ranger says special orders which would allow him to shut down public gatherings are not yet necessary.
In terms of giving orders, using legislative powers to instruct events not to take place, I think we are very far from that. This is a large-scale outbreak in Auckland, and it needs to be taken seriously. But life goes on.
And he's confident the tide will turn.
With good immunisation outreach, with the message getting out about vaccination, there's every chance that in Auckland the rate of increase will slow and we will reach a plateau, and then we'll be on the downside of it. I can't predict when that's going to be. The answer lies with people who are not vaccinated getting vaccinated.
Carmel Ellis of County's Manukau DHB says it's proving difficult to know how many people that involves.
With the National Immunisation Register, we've got really good data for those younger than 14 years. If we look at our 2-year-old information as well as our 4-year-old, we're well into the 90s, so we know we've got good coverage there. For those kids older, we don't have a centralised register that captures that information, which is why this is a bit of the unknown. That information is either held by parents or within primary care. So we find it really difficult to figure out how many people we need to immunise or how many people aren't fully immunised to have a target.
For parents out in Auckland's Mount Albert today, immunisations were a no-brainer.
No, it was always going to be the case. Always get most of the population immunised and protect everybody.
I think so. We agree to get our kids to immunizated. Yeah, I think it's safer.
She's too young to get vaccine at the moment, but also we can't stay inside all the time as well. So, yeah,
just got to take the risk.
Yeah, basically.
Dr Ranger says parents must not delay getting children vaccinated at 12 months and 4 years, and to make sure older children are vaccinated now if they have missed out. In Auckland for Checkpoint, Nita Blake-Persen, Aho.